Welcome to Thermography Medical Clinic's webinar series. Today, I'm going to be talking about thermography and breast cancer. My name is Sharon, and I am a registered homeopath, a holistic nutritionist, and a medical thermographer. I am the founder and clinic director of Thermography Medical Clinic since 2010. I am an interpreter for Thermography Medical Clinic. I was the clinic founder and director of Divine Living, which was a natural health clinic from 2005 to 2022. My philosophy is a personalized, proactive, and preventative approach to healthcare. These are some of the most common questions that are asked about thermography and breast cancer, and I want to provide you with the answers. Will thermography tell me if I have cancer? Will thermography see cancer before I have it? Will thermography see any other disease? Is thermography a replacement for mammogram? I had a thermography and it didn't indicate any abnormalities in my breast. I was diagnosed with cancer 3 months later. How come? I have breast cancer and thermography didn't show any thermal changes where the lump is. Why? What do I tell women who want to use thermography to monitor breast health? And so why have a thermography assessment? And should we still promote breast thermography? Let's discuss these things. Thermography is not a diagnostic test for cancer or any other disease. Thermography does not see cancer early, and it does not have the ability to predict if someone will get cancer. There is no specific thermal sign or signature that diagnoses breast cancer. For some people, the only thing they think they know about thermography is that it is a test for cancer. I want to dispel that myth and explain the role that thermography has when it comes to breast cancer. Does thermography see cancer early? Let's talk about this. This is false advertising and misleading information. A simple Google search on thermography often brings up claims such as, thermography will tell you if you have cancer 10 years before other tests. This is simply not true. Thermography is an alternative to mammogram. This is also not true, and even the FDA says that this is not the case. Thermography is better than a mammogram. They can't really be compared because they are not the same type of test, and I will talk about this later. Mammograms look at structure, and thermograms look at physiology, how the body is functioning. Some people claim that thermography provides a risk assessment. Thermography cannot rate your risk of developing disease on a scale of 1 to 10. A lot of thermography companies speak about thermography in this way to increase the uptake of thermography appointments. These false claims about thermography often leave women disappointed and confused, and they often are left wondering what is the value of having a thermography study done if it won't see cancer early. Thermography is not diagnostic, meaning it doesn't have the ability to diagnose any disease. The role of thermography is much more valuable than a diagnostic tool. It is the only test that can give you a picture of your health and show you where your body needs help. Thermography does not see tumors or any specific disease. From an approval and regulatory standpoint, thermography is an adjunctive tool, meaning it is to be used in combination with other tests, and that goes for mammography too. It is not a replacement for mammograms. Thermography is not a crystal ball. No single test can predict our health future, and no test can predict which disease we will develop. But thermography has its own unique contribution when it comes to your health. I often tell people that health is a journey, and throughout our life we experience various stressors, accidents or injuries occur, lifestyle behaviors change. All of these things affect our health. When looking at a person's health through the lens of a thermography camera, we can see how these external and internal factors are influencing our health. Did you know that we all have our own unique thermal signatures that indicate how your body is functioning and what organ systems are stressed? Let's take a look. Can we predict which of these women might develop breast cancer? Let's do a test, then I will explain the results to you. What do you see here? The first picture is considered to be an elevated level of concern in the left breast, or a Th4, meaning a high risk, which implies a high risk for cancer, according to some interpreters. The second picture is considered to be a moderate level of concern, or a Th3, moderate risk in the right breast. But there is something else going on in both images. Is this cancer? Is it going to be cancer? Both women have inflammation in the breasts. But what is more important is knowing why. How about these images? The patterns in the first image suggest low level of concern, which implies not much at risk here for breast disease. The second picture is also low level of concern. Let's see what is really going on in each of these images. Picture 1. If you remember, the inflammation in the left breast is actually related to a fistula for dialysis. So she doesn't have breast cancer or any breast disease. This is simply the body's response to the dialysis treatment. In picture number 2, the inflammation in the right breast is related to dental infection on the right side and was resolved after having the dental problem addressed. And I will show you this later. Picture number 3, she's actually diagnosed with breast cancer in the right breast. And in this case, we should be looking for the cause of the problem. Picture number 4. She is also diagnosed with breast cancer in the left breast, but can you see it? She has inflammation in her whole body due to high levels of stress, which makes the body toxic. And this was discovered by this patient having a full body study. Let's review picture number 2. This brief case study provides an example of how thermography can identify inflammation caused by underlying problems before they become serious chronic conditions. This young woman came for an initial thermography study with concerns about an enlarged thyroid. The key findings in her thermography report were as follows. She had dental inflammation that was noted in the lower right wisdom tooth. Keep in mind that dental pathology can contribute to problems elsewhere in the body. And in this case, thermography identified a previous underlying unidentified infection in one of her wisdom teeth. The right breast presented with a vascular pattern in the upper region and increased temperatures here as well. Such findings may be an early indicator of breast pathology. Thermography is useful for identifying inflammation and physiological changes with or without symptoms and before something becomes a problem. Next, I will show you the outcome of the study after the cause of the problem was addressed. What alternative technology would allow you to identify and interpret these findings? Let's examine the images from the follow-up imaging after the extraction of the wisdom tooth and following a lymph drainage protocol. Most of the previously observed thermal findings in the dental region, or the area around the mouth, across the forehead, and over the lymph drainage pathways in the neck, are gone. The follow-up breast image shows a significant reduction in the vascular activity in the right breast. This case study highlights the unique role that thermography can play in a health and wellness plan and the immediate benefits of a proactive approach to dealing with early indicators that thermography can identify. Let's review picture number 4. In picture number 4, if you recall, she was also diagnosed with breast cancer in the left breast. There are a lot of inflammatory patterns in both breasts, and what I'm more interested in is looking for the underlying cause of the breast cancer. So we know that chronic inflammation leads to diseases such as cancer, and what is even more important is that we look for the underlying cause of the inflammation. In this case, this patient had a prolonged period of emotional stress that put her body in a constant state of fight or flight. This stress response over time can disrupt the delicate balance of good and bad bacteria in the digestive system, leading to a compromised immune system, which is the perfect environment for illness. We need to address the cause, which is the emotional stress, the fight or flight, the digestive health, if we want to heal the patient. Did you know that stress can significantly impact your health? How one reacts to stress appears to be a major factor in a large number of contributing causes of cancer and disease. Most cancer patients have experienced a highly stressful event, usually about 2 years prior to the onset of detectable disease. This traumatic event is usually beyond a patient's control, such as the loss of a loved one, loss of a business, a job, home, or some other major disaster. And this is how stress affects the body. When a person experiences stress, such as injury, emotional stress, a trauma, the death of a loved one, a loss of a job, or whatever the stress may be, the body goes into fight or flight. It's also known that the thoughts that we think can cause the fight or flight response. So if we imagine a scary event, or if we are always worrying about worst case scenarios, then this can also trigger the fight or flight response. Fight or flight causes adrenaline to surge, and adrenaline transports sugar away from the cells. When adrenaline is depleted, sugar builds up in the cells of the body, which allows virus, bacteria, yeast, fungus, or other toxins to inhabit normal cells to feed on this excess sugar, breaking the cell's oxygen cycle. This ultimately results in inflammation, the precursor to disease. So what should be done then? Does it make sense to treat the symptoms, or does it make sense to treat the cause? Let's take a look at another example. Dr. Robert Jones, he found an extremely high correlation between root canals and breast cancer. Tumors in the majority of cases occurred on the same side of the body as the root canal or other pathology. This lady has breast cancer. Should she treat the tumor, or should she address the dental infection? Should she do it all at once or in a prioritized sequence? How would she even know the options available if we didn't image the whole body? Will thermography see any other conditions? Thermography does not diagnose any condition. These are some other frequently asked questions about thermography. Can thermography see irritable bowel disease, diverticulitis, Crohn's, or colitis? Can thermography see conditions like Lyme disease, leukemia, ovarian cysts, or arthritis? The answer is no to all of these. But the good news is that thermography can give you insight into the underlying cause of these conditions. Let's move on to the following question. Is thermography a replacement for mammography? These are entirely different tests and they cannot be compared. Thermography and mammography cannot be compared, just like apples and oranges can't be compared, because they are different fruits with different flavors and different nutritional components. Mammography is looking for a tumor, and thermography is looking at how your body is functioning. So what is the difference between mammography and thermography? A mammogram uses radiation and direct contact by way of compression of the breast tissue to look for the existence of structural changes in the breast. It is known that overuse of mammography can result in excess radiation exposure and damage the breast tissue related to the compression. Thermography is a test of physiology. The thermal maps that are captured by the camera can be interpreted and evaluated for signs of inflammation, lymph congestion, organ system stress, infection, all of which could be the underlying cause of breast disease or other chronic diseases. So what is the role of mammography compared to the role of thermography? Mammography is a structural test, which means it's examining a small part of the body, trying to locate a specific finding, in this case, a tumor. Thermography is a test of physiology, which means it's looking at the whole body to identify inflammation, the cause of that inflammation. And this is why it's so important to have a full body study done, not just a breast study, so that you can actually see if there are underlying issues that are causing breast inflammation. So when it comes to breast cancer, thermography is a test that can answer the question why. What should you consider if someone is telling you that thermography replaces a mammogram? Let's answer this question next. Thermography is not superior to mammography. The test that you choose to have may be determined by what you are looking for. So, if you are looking for a certain disease or a diagnosis, then you would choose a test that could tell you that information. However, if you're interested in how your body is functioning, or if you want to know if you have inflammation and what the cause of that inflammation is, then thermography is the test for you. If you're experiencing symptoms or you have a diagnosis and want to know the underlying cause, then thermography is also for you. Mammography is a personal choice and one that shouldn't be influenced by thermography companies who advertise thermography in place of a mammogram or thermography as a test that sees cancer early. Thermography is not a test that needs to compete with any other test. It has its own unique contribution to healthcare. Coming up is another question that I have had to answer on a number of occasions. I had a thermography study and it didn't indicate any abnormalities in my breasts. I was diagnosed with cancer 3 months later, and I have been told that thermography sees cancer 8 to 10 years before any other test. So what happened here? Why didn't thermography see it? We should be telling people the truth about thermography. Thermography is not a test that diagnoses cancer. We need to stop misleading people into believing that this is what this test does. So, thermography didn't see the cancer because it isn't a test that diagnoses it in the first place. Cancer is a chronic disease which is the result of inflammation, and thermography is our best tool to identify inflammation and the cause of that inflammation. Thermography will show you something else that is of critical importance when it comes to addressing the underlying cause of breast cancer. The next question is the following. I have cancer, why didn't thermography see it? We must also be able to answer this question. Thermography provides answers to why, but it does not diagnose any specific condition. It answers the questions, why do I have this disease? What is the underlying cause? What is the source of the problem? We know that cancer is a symptom of a much bigger problem which needs to be addressed. Tumors and cysts are essentially collection chambers for inflammatory cells, toxins, bacteria, viruses. So you can remove the tumor, but you still must find the source of the problem and address it. If you already know you have cancer, there's no point in spending money on a thermography study to tell you something you already know. Instead, spend the money on a thermography study to answer the question why. So, why have a thermography assessment? What is the purpose? To visualize our health. Thermography shows us inflammation in the body and how stress, our lifestyle choices, musculoskeletal imbalances, and even organ system stress are affecting your health. Thermography can show us areas of concern that may require further clinical evaluation or correlation. We can see the possible source of the problem. Thermography is an excellent monitoring tool that allows us to visualize changes in a person's health status over time. How should we promote breast thermography? It's better to present breast health in the context of whole body health. Remember, our breasts are not separate. Breast health is directly related to overall health. Breast health problems are not caused by a single factor, and there are a wide variety of internal and external factors that can contribute. Certain factors like genetic predisposition, but the research consistently points to external factors and lifestyle choices having more of a significant impact on breast health. So how can thermography help you? Thermography can help to evaluate and assess your current state of health. Thermography allows us to see the level of inflammation, which is the precursor of disease. It can allow us to evaluate the cause of the inflammation or the source of the problem. And thermography lets us monitor the progress of the patient. Are they getting better or are they getting worse? And have we successfully addressed the underlying cause? Are you concerned about your health? To learn more about how thermography can help you, the following videos are available on our website, thermography.medicalclinic.com, and our YouTube channel. For more information, you can visit our website, thermography.medicalclinic.com, and follow us on Facebook and Instagram.